Postpartum Education and Increasing Exclusive Breastfeeding Rates, a presentation by CC Needs. A little background information. Breast milk has innumerable health benefits for newborns through 24 months of life. Infants who are exclusively breastfed for the first 6 months of life have a lower rate of morbidity than those who receive only partial amounts of breast milk. This includes lowering the risks for developing chronic illnesses such as asthma, type 2 diabetes, and obesity. If that was not enough, multiple studies have shown that there is a direct correlation with the duration of breastfeeding and improved intelligence. Despite the innumerable benefits of breast milk, breastfeeding rates are only at 44% worldwide. And through this author's experience, it can be understood why so many women give up, especially in the first few months after birth. Breastfeeding is hard. It is emotionally exhausting, painful, and extremely time consuming. These can be compounded without partner support, peer support, or if mothers are of a low social economic status. When mothers feel that they are inadequate for their child's feeding needs, formula can be an easier choice many times. With formula, there are no round-the-clock pumping schedules, feelings of breast engorgement, cracked and painful nipples, mastitis, or challenges with the baby latching. In addition, there are no misconceptions that the baby's not getting enough to eat. It has been shown that with increased breastfeeding education, resources, and support, the duration of time that a mother will breastfeed her baby increases. This is a significant opportunity for nursing to increase patient education and increase the rates and duration of exclusive breastfeeding in hopes that mothers reach the 6-month mark of exclusive breastfeeding for their babies. My PICO question is, in postpartum mothers, how effective is increased formal breastfeeding education with multiple modalities of support compared to no postpartum breastfeeding education on increasing the length of time a baby is exclusively breastfed? Breastfeeding education is not a one-size-fits-all package. Face-to-face educational sessions in conjunction with telephone follow-ups by an international board-certified lactation consultant were associated with increased rates of EBF in women in Lebanon. Postpartum women in Malaysia were asked about the information they received in an anti-breastfeeding education course. Was that information useful to them? 99% of the women stated the information was useful, but they did find gaps in education. These mothers wished to be educated on expressing breast milk, milk storage, and overcoming low milk supply. Theory-based education has also shown to be more effective for increasing breastfeeding rates and duration. Gardner's theory on multiple intelligence was used as an intervention on 104 pregnant women. By using this theory-based education, 53% of mothers increased their breastfeeding knowledge and 68% practiced EBF for at least 6 months. In contrast, the control group, who receives a standard pamphlet education, was 41% and 43% respectively. Malike and Shafai both use Albert Bandura's theory of self-efficacy, and through their education strategies, both saw increases in breastfeeding duration through self-efficacy. A mother's self-efficacy in breastfeeding can become a barrier to breastfeeding rates and duration. Education should be aimed at finding these barriers and addressing them for these women. While the act of breastfeeding falls on the mother of the infant, the involvement of the father has shown to increase breastfeeding rates and exclusive breastfeeding duration. Online support was a huge topic. The major themes they found for why mothers were turning to online support included feelings of isolation by the mother, unmet support by healthcare providers, a preference for online support, easily accessed and always available, real-life experiences, empowerment of self and others. They found, through a randomized control trial, at 6 months, the intervention group had 33.3% EBF compared to 8.3% in the control group. This study showed that by increasing self-efficacy through controlled social media posts, EBF duration was increased. For this review of literature, I chose Albert Bandura's social cognitive theory. It says that people learn through multiple factors and their relationship with each one. These factors are behavioral, environmental, and personal. Learning is done best through social context, and the foundational thought of self-efficacy the belief in one's own capabilities, and the effect that it has on the effort that they chose to put into the task. This is the model that was used. It is a great framework for the social cognitive theory. You can see the interconnection from the environmental factors, personal factors, and behavioral factors. Conclusions from our review of literature. Breastfeeding education has a direct correlation with increasing EBF duration. Education must begin in the antenatal period and continue through postpartum. Theory-based education, including using multiple modalities, are more effective than traditional education. Fathers should also be included in the education. Mother self-efficacy is the most important factor considered with education, and online support groups can be an adjunct to education for these women. These are my references. I hope you enjoyed this presentation.